Dr. Nitish Arora. And he will be presenting on the fixing the skewed in the blue eye girl.
Fixing the skewed eyes.
Yeah, skewed eyes.
Dr. Nitish Arora, I'll be talking about fixing the skewed in a blue-eyed girl. So my case is a case of a 9-year-old girl who presented to my OPD with chief complaints of change in color or pigmentation of the eyes and squint appearance. So on external examination, the presentation was diffuse iris hypopigmentation, telecanthus, mild cyanophorus, that is unibrow, congenital white forelock, which is not seen in this picture, presented for treatment of heterogeneous iris color and squint appearance. She was complaining of squint. So on examination, she was having a vision of 6/6 and eyelids show medial canthal rounding and telecanthus. Other findings were all normal. On fundus examination, we could this is external photography where left heterochromia iridium can be seen. On fundus examination, there is a junction of hypopigmented choroid and a normal choroid, and on autofluorescence, we could see the area of hyperautofluorescence. So a diagnosis of Waardenburg syndrome type 2 was made on the basis of these are the in Waardenburg syndrome. It is a group of genetic condition that can cause hearing loss, which is present from birth, congenital. Changes in the color of the hair, skin, or eyes. Pigmentation is not there. Pale blue eyes or different colored eyes, such as one is blue and other is brown. Sometimes there is segments of two different colors in the same eye, and distinctive hair coloring. The features of Waardenburg syndrome vary among affected individuals and even among in the same family also. So the types of Waardenburg syndrome, in type 1 there is widely spaced eyes, that is called telecanthus. Second, in type 2 there is hearing loss, sensory neural deafness alongside type 1. In type 3 there is abnormalities of arms and appendages like arms and hands in along with type 2. And in type 3 there are gastrointestinal symptoms like blockage or constipation like symptoms in the patient. So patient's mother also had telecanthus, but which was not a complaint, it is an incidental finding. So our plan was to give a better look to the patient. She was complaining of pseudosquint and telecanthus and was offered a cosmetic contact lens thereafter. So audiometry was done and she was diagnosed with sensory neural deafness, and gastrointestinal examination was normal for her. So our plan was to do a CU-plasty for her. So surgery was done under general anesthesia. Firstly, the ideal intercanthal distance was calculated, which should be at least half of the interpupillary distance. And due to post-operative fibrosis, we planned to excise 1.5 times of the amount of desired correction. So amount of telecanthus correction needed in each eye is half of pre-operative ideal intercanthal distance minus IPD. So the calculations were made and the distances were calculated and the excision was done. So markings of the surgery were done and surgery was performed. But what to do about the medial canthal rounding? So fixation of the medial canthus can be done by fixation of a transnasal wiring, which is quite a traumatic procedure, and fixation of cantilevered mini plate, which requires too much of instruments like striker and a mini plate, which has to be customized. So we planned to give a non-traumatic, not much traumatic, like fixation of medial canthus by medial canthal tendon plication. So the procedure was done, and post-op day 1, she was like this with some edema. Post-op day 7, the look was better, and on post-op day 21, she had a good outcome. As per, we were able to achieve increased distance between two medial canthi, correcting the telecanthus, and we were able to achieve the angulation of the medial canthus alongside increased medial scleral show, correcting pseudosquint appearance. So the aim was achieved of improving the appearance, making it less traumatic, and patient was happy and was given colored contact lenses later for heterochromia. Thank you.
Next presenter.
These kind of cases should be in larger halls really. They are, eye openers for everyone.
Yes.
Putting them in this kind of hall is a crime.
I know.
They should be in big halls.
Yes.
People should know that these kind of conditions do exist. They do happen. And we used to do the masquerade, that Mastardi. That one.
Double Z plastic.
Yes. And that does wonderful things, and you can fix these ligaments on the periosteum also. But cut it and fix it. Wiring, I hate. Never.
Yeah.